Assalamualaikum and good morning to everyone. Today our group, which consists of me, Alim, Eden, Hakim and Fa'ad.
Yes.
So social media has become an integral part of many healthcare organizations, marketing and communications strategies. So across the United States, almost 99% of hospitals have an active Facebook page, and increasing number are also establishing a presence on platforms like Twitter and Instagram. So recently, there have been a number of doctors who use social media as a medium for health communication to educate the public. So in our opinion, health communication through social media is not an effective to educate the public. So our main point will be divided into three, which is time constraining, fake information will be exposed, and the last one is reduce the professionalism.
So firstly, in our point of view that support this topic is not effective is about the time constraints. As we all know that doctors are typically fully booked every day. Sometimes they have their own problem and also their family matter. Even though they have free time, the hospital are often quick to assign them last minute appointment, or we call it as on call. Therefore, sometimes the doctor who have their patient through the social media will not have enough time to serve their patients. This will lead the patients to be mad and take their own action before thinking thoroughly. So I will give you an example. Sometimes the patient asks the doctor, but the doctor is too busy to reply the question of the patients. Therefore, the patient will take the action by going through the social media and find out the information, but sometimes the information is not true. Therefore, this action will give the harmful to the patient itself. Later on, at the same time, it will taint the reputation of the health organization itself. So, to sum up, it is proof that time constraints is the reason that make this topic is not effective.
Thank you, Hakim. So I will continue for the second point, which is the fake information will be exposed. So as we all know, nowadays the social media is one of the platform to someone to gain information, and everyone can go for it. But therefore, the percentage of someone of facing the risk is high. Because one study from a doctor at the hospital for special surgery in New York found that the overall quality of the health information in the social media poor and difficult to regulate. Even more, the spread of the poor information can damage the patient trust in their doctors.
So now I will continue the last point for this topic, which is it can reduce professionalism. As you all know, when we post something on social media, it will open publicly. So if let's say if doctors post pictures or videos on health topics, and they post and it has unprofessional content, such as they talk about their patients' privacy, about their patients' negative attitudes, the institution's negative service. So this will impact them, even the doctors itself. This will lessen the trust of public to the doctors, institutions and the patients. When the trust is lessened, so people will the doctor's reputation, the doctor's or institution reputation will drop down, and this will affect the health community in our country. In short, health communication through social media in educating public will have a bad effect. We have bad effects, which is reducing professionalism.
To sum up all the main points that we have discussed before, indeed, health communication through media social is not effective in educating the public. It is because the time constraint for the doctors, since they are too busy to treat the patients at the hospitals. Next, the fake news can be spread by anyone else since it is too easy for nowadays. And lastly, it will reduce the professionalism because the bad side of the patients will be open to the public and will drop the reputation of the institution. Okay, that's all. Thank you.